morning, everybody. I started in the industry when I was 5. So just to give you a bit of a snapshot. And I have to say, I just wanted to share a really lovely story that I had talking about our mums around the table this morning. My mum is absolutely beautiful. She's 84 years of age, still going really strong, but a little hard of hearing. And I said to her last week that I was coming along this morning to talk to the World Continence Week. And she looked at me and she says, "Oh my goodness, Alex, you never were very good at geography." And I had to say to her, "Continence, Mum, E-N-C-E, not E-N-T-S." So she was, having a little bit of a giggle after that. Mind you, in the context of our family, my brother, my younger brother, is a geophysicist. So he's often talking on the world stage around geology and geography and all of those sorts of things. So I think she was also starting to get just a little confused about what we do. But here we are today. Thank you so much for the invitation to come along and talk to you all this morning. For those of you who battled the traffic like I did, it was an interesting start in the very heavy rain and so forth. So I'm going to give you a bit of a high-level overview of the NDIS as it is. I've got a very short 20 minutes, so it is just an overview. If any of you have questions and we have time, I'm happy to take those at the end of it. But many of you will know that the National Disability Insurance Scheme has 3 fundamental principles for which we actually aim to achieve. It is based on an insurance approach, which basically means that we are investing in people's futures to try and make sure that they can live much better lives, much stronger lives for the longer term. And the way that we do that, of course, is investing in very strongly in research, aids and equipment, technologies and those sorts of things, so that they can actually live their lives better, more independently and for much longer. Choice and control is central and quite pivotal to the way the agency works. And certainly they're the sorts of things that I've just been speaking to a couple of mums in the crowd this morning, which is really about that real challenge that people are finding where they're now previously been told where they'll get their supports and what they'll get and how much they'll get and when they'll get it, to now having to be in control and making choices about all of those sorts of things and making sure that the products and the services that they're getting are actually designed and fit around their lives, not the other way around. Community mainstream, of course, is also pivotal to the way we will work. The scheme has 2 core processes that we are requiring to do. One is about how we work with participants who are engaged in the scheme, but also about how do we work with those community mainstream supports that continue to make sure that people can access ongoing daily services before in fact they become participants of the scheme. And that is essentially important for many people who are in the early stages of some forms of disability. People with epilepsy, for example, people with multiple sclerosis, many conditions where in the early days they may not need the services of the NDIA, but are starting to look for good forms of information, referral points, where do they get good advice from their GPs and their specialist supports and those sorts of things. So it's quite important for us that we continue to make sure that we have a very strong mainstream and community range of supports for people with a disability. I've given you here just a little bit of an overhead slide, and I'm sure that we will make this presentation available to people if they want to. That's correct, isn't it? So if you want to have a look at these at a later point in time, you can. Essentially, the insurance principles, as I talked about before, starts from the mere fact that all of us as Australians are now contributing to the scheme. And the way the scheme then works is that money is then allocated directly from the agency to participants, and they make the choices there about where they spend those resources. I won't spend too much time on that for this morning. Just a little bit of a history on the NDIS. So there's quite a few dot points there. You'll see I've started this from 2008. But in fact, the history of the NDIS, or the insurance program of the scheme, goes back way before 2008, when it was initially suggested as a scheme quite some time ago, back in about the 70s, I think. But at the time, things didn't quite there wasn't the strength, I think, in support from the community to actually get it running. But it resurfaced in 2008 in the 2020 summit that Kevin Rudd, of course, proposed. And it was one of those little yellow stick-it notes that got posted to the wall in amongst, you know, the hundreds of potential great ideas that Australians all came together to propose. This one little yellow post-it note is now a $22 billion scheme that many people with disabilities are starting to enjoy as part of their supports for having a disability. But you'll go through all of those. In 2009, I was lucky enough, I worked for the TAC in 2009, and by sheer fluke, my manager at the time came to me and said, she said, I was supposed to be in Sydney next week speaking at the National Labour Conference. And she said, I can't go. Could you step in for me? So in 2009, there were two things where Alan Woodruff and I from the TAC, Alan's been heavily involved in setting up the scheme here in Victoria as well. So we trundled up off to Sydney. There were two things on the agenda that day. It's a national dental scheme and a national disability insurance scheme. In the morning, they presented quite a lot of information around dental services and how that would assist in supporting, making sure that people had good dental care throughout. It got knocked off the table by about 11 o'clock in the morning. I turned to Alan and I said, we haven't got a hope. If Australia can't commit to having a national dental scheme, we've got no way, there's no way this will actually work. But by mid-afternoon, we'd had been able to rally the sort of the supports and the efforts of everybody in that room. We presented two cases on that day. One was about a young lady who suffered a severe ABI as a result of domestic violence. Interesting that in this year, domestic violence is also now capturing the world's attention. The other young lady, of course, was a car accident victim. And the two cases significantly highlighted the differences between an insurance scheme that supported people post-injury particularly through the early days of rehab and hospital services into longer-term care, and those people who were at the behest of the public health system. And so this young lady, of course, spent many, many years in a nursing home. The young lady who was a victim of domestic violence, having not been able to be discharged from that nursing home to her own private home. Those two cases, of course, highlighted the desperate and dire need for Australia to be better than that and to invest in this scheme. So that takes us, of course, now to today, where in just over 2 weeks' time we will be rolling out the scheme more broadly right across Australia. And significantly, you know, places like Darebin will be taking on 10,000 people just in the next couple of years. So this, the next slide I've got for you here actually gives you a little bit of a demonstration of those particular numbers. So the light blue areas there are, of course, what the number of people who are currently getting access to funded supports. The darker blue, of course, gives you the number that will be getting access to funded supports by the year 2019, when we've got everybody in at just over 462,000 people. So it shows you the significant growth in how many people will actually start to be able to access supports and services through the agency. How are things changing? You'll know, I talked a little bit about this morning in terms of previously to this, we have had people who've been told where they'll get their services from. They'll often have struggled to be on the end of a wait list for significant times. I know one of my very best friends was on the Disability Support Register in Geelong 14 years. She'd been waiting on the DSR to get access to services. For many of you, you will know that that is longer than the public housing waiting list. Tina was never going to be, unfortunately for her, she was almost never going to be in a position where she was in crisis. And as many of you know, most families had to get to crisis point before in fact they were able to get any access to an individualised support package. So I think, in terms of the way people get access to services now, once you actually have a disability, of course, there is almost a right of play in terms of how you get those services, particularly around reasonable and necessary costs and so forth for supports. The choice and control I have also mentioned this morning, which is a very strong principle of the agency, is very much about making sure that people get choice and control. That is very different to where we've come from, where people, with the block funding arrangements, of course, is that people have had very little choice about where those services derive from and so forth. The level of assistance, of course, is quite significant. So we've gone from a capped-based program to a demand-driven process where people, based on their reasonable and necessary supports, will be assessed and provided with the amount of assistance that they need. And of course, the funding regime is very different in that we actually allocate the money to actual people themselves. So what do we fund? What is the NDIS funding at the moment? I wanted to just talk a little bit about this in terms of you'll see I've got half a dozen dot points there around particularly daily and individual supports for people is very strong. We've had a significant increase in the growth in this area, along with the growth in supports for people to access services after hours and weekends and so forth. So that's been a really significant shift, particularly for the sector who's been very used to delivering group activities and so forth, Monday to Friday, 9 to 3 p.m. And then all of the mums and dads, of course, have had to, make sure that their jobs fit around 9 to 3 and go home at 3 and try and juggle, after hours, school care and those sorts of things. So when your child is 43 and you're still working 9 to 3 to make sure you can pick up your child at 3:30, really, where are we? So the significant shift for many of our providers has been absolutely in that area. Vehicle home modifications are all part of what we actually do now. We're starting to be much more flexible about how that works. Assistive technology is also one of our most significant growth areas. And whilst I've mentioned before that we're actually spending a lot of time in research, we know that the growth in how we're actually supporting people with assistive technology has been absolutely enormous. And what I wanted to top on this morning, talk about this morning, was what we are starting to see was particularly the demand for things like continence nurses and reassessments and so forth has gone right through the roof. And much of that has been about it because the previous health system, of course, had very limited opportunities to actually respond to that need. I've been funded to do 200 assessments every year, so that's what I'm going to do, and that's how much we can afford to do. With this scheme, of course, what we've realised is that many people, particularly those who live in group accommodations, and we've got a large centre down in Colac, it has been significant years since any of them were afforded the opportunity to have a reassessment done for continence. I'll talk about continence. We do find this across all of the other areas, but I think particularly for this morning it's really important that I put that into perspective. Many years they've spent without having a reassessment done. Our products, of course, have changed significantly over the last 20 years as well. So what we've actually found is people are using very outdated equipment. It's not appropriate for them. There's so much better outcomes that we can get for people just purely by making sure that they actually get the best and the latest products that are available for them and that are actually assessed as the most suitable products for them. Not just purchased on large-scale items, because that in a large-scale sort of process, because that's actually what happens to, be as efficient as we possibly can. We need to make sure that the effectiveness of what we're actually doing is there. So what we've certainly found in terms of doing that is that we've actually got an incredible shortage of continence nurses. Demand all of a sudden has gone through the roof in terms of how we get that assistance out there and how we tap people into making sure that they do that, get access to the supports. So I think we will start to see, and particularly as we move from 2016 to 2019, that demand will continue to grow. And I think that's really vitally important in terms of how we support people to make sure that they can get access to the right assessment, B, get the right information about what they need, and then C, get the products in a way that is easy for them. They continue to have those really good relationships with the suppliers that they've got, and they can move on. We know that continence support is pretty fundamental to how people can then go on and get on about their daily lives in terms of employment outcomes and daily supports and all that sort of stuff. So we're certainly very keen to make sure that the fundamental and daily requirements of people with a disability are supported well. What we don't fund, there are a couple of things there in terms of what the NDIS doesn't fund. Some of those things have been largely around how we connect to the health services sector, so we don't fund medications and those sorts of pharmaceutical supports, which in some cases have been provided through the person's disability support package before. Day-to-day living costs, of course, are all basically there. And anything that's funded through the Medicare sort of health system, but I'm sure you're all fairly familiar with that, so I won't spend too much time on it. The health system, of course, I talked about, how we reshape the electoral boundaries, and and that elastic band that we often have where we sort of push it a little bit more over the hair, but we pull it in there. And that's certainly what we've experienced with our relationship with the health system, particularly for people with a disability. So just because you have a disability doesn't mean that the NDIS will be responsible for all of your care needs. If in fact it's a healthcare need, we're still very much relying on the healthcare system to actually make sure that they're doing their bit as well, but that we work in partnership with how that actually occurs. It's very important that we continue to try and do that and make sure that that's very clear. Just to really give you, I'm really mindful of the time that I'm taking up this morning, so a couple of snapshots on terms of what we have achieved to date. So there's some interesting sort of dot points for you at the moment. 29,500 people there in terms of who've become participants of the scheme. We've got a spend of $1.96 billion. Our participation satisfaction rate still remains very strong, and those sorts of things are really important for us. Despite what you hear in the Australian Financial Review, we are on budget, on target, and delivering really good supports. So please don't be too worried about people who tend to want to change the way, reconfigure what our studies actually say in terms of what they're printing out there in the press. So we continue to be quite strong. The July 1, of course, will be a significant challenge for us in terms of how we, another step up. It's an enormous number of people who will be coming into the scheme from July 1. I have been heavily focused on working with our design people around our new ICT system, and certainly there are a couple of really quick, really easy wins that we've been able to put into the ICT system that I'd like to share with you this morning. A couple of things. So most people who get continence products along with things like hen products, so hen products, of course, most of you will know are the food supplements program. Those supports will be allocated to people who need them as part of their daily supports. It's a package type arrangement. Many of those products used to require a quote in terms of getting those. We know we've taken that tab off, so it's people will be allocated that funding and they will be able to literally go to their supplier and purchase those and manage much of that funding themselves. So I think that's been a significant win for us in terms of doing that. We've also added into the program things like daily adaptive equipment, so things like you know, your shower chair and your sorts of things that you can buy from your local equipment store and your chemist shop, or those sorts of things that just keep people going. They're available also in those core supports, because they are core supports. They're fundamental to the way people go about living their everyday lives. And so we've actually really had a very clear focus on making sure that we make that much easier from 2016 to 2019. So I think we've certainly have been aiming at making sure that it's much more accessible, it's much more efficient, and much more effective for people with a disability. So on that basis, thank you very much for your time. Thank you. Thank you.